All right, so to show you the bony anatomy of the knee, first thing is look down here at where it says Figure 3, Anatomy of the Knee. It tells us that this is the anteromedial aspect of the knee. So that means it is the inside of the knee. So we're looking at it from the inside point of view. Medial is here. Okay, so on the femur is the bone that is up top here. Okay, you will need to know the adductor tubercle, the medial femoral condyle, medial femoral epicondyle, and all of those are on the femur. Okay, then you have this circular bone right here, which is called the patella. All right. From there we go into the tibia. Remember, the tibia is the shin bone. The shin bone goes all the way down the leg. Okay, so from here we have medial tibial condyle, and then the dot right there is called the tibial tubercle. Easiest way to remember where the tibial tubercle is, it's easy for ladies, because ladies, when we shave and we shave very fast and we move too quickly up to the knee, this is where we nick our knee or we cut it. It's also where some people have bony outgrowth, and that is called jumper's knee or Osgood-Schlatters disease. All right, move the picture a little bit, maybe. So now we're going to look at the lateral aspect of the knee. So we're looking at it from the outside. All right, the way we know where we are on the outside of the knee is you will see the fibular head. All right, the fibular head is this area right here, right, which is what we call the fibular head. Okay, then since we're down here, we're going to start with the tibia. You need to know the tibial tubercle again, the lateral tubercle of the tibia, and the lateral tibial condyle. Right, all of those go right here with the tibia. Then we again have the patella and the patella tendon. So as we move up the leg, coming in here to the femur is the long bone in the upper leg. We now have the condyles on the outside. So we have lateral femoral condyle and lateral femoral epicondyle. And those are on the outside of the knee. The last part of the bony anatomy picture deals with the bursa. Bursa, you can think of fluid-filled sac or water balloon. The bursa help the knee decrease friction, which is why when you land on your knee or you get hit in the knee, it swells a lot. Because as you can see, we have 4 bursa. All right. The main one is the prepatellar bursa, which is on the front of the knee, right on the patella. So that's our patella. Pre means before. So prepatellar bursa is going to be the bursa sac on top of the patella. Then you have the superficial and the deep infrapatellar bursa. Those sandwich the patella tendon. Think of all the jumping, running, and just moving the knee that we do on a daily basis. If we did not have these fluid-filled sacs on either side of the patella tendon, then we would have a lot of friction. All right. These bursa help decrease the friction of the patella tendon. And then the last one is the pes anserine bursa, which is right in this area. As you can see, it comes down right here. This is the hamstring, and then this is the adductor muscle. So both of those come in and they attach under the knee. They attach right under the medial tibial condyle. When the knee bends and straightens and the hamstring's really tight, it causes a lot of inflammation, which is why people with a hamstring strain sometimes have discomfort below the knee joint. Right? To review again, with the knee, from the medial side, that's the first figure, you have the medial condyle, the medial epicondyle, both on the femur. You also have the adductor tubercle, which is on the inside. The front of the knee is the patella, followed by the tibial tubercle right below it. If we look at the lateral aspect of the knee, the patella stays in the same place. Right below the patella is the patella tendon. Right under that is the tibial tubercle. Those landmarks do not change from medial to lateral side. Use those as a reference point. Then moving to the lateral side, where I have it completely highlighted in yellow, is the fibular head. In between the fibular head and the tibial tubercle is the lateral tubercle. Okay? Then you have the lateral tibial condyle, the lateral femoral condyle, and lateral femoral epicondyle. Same words, just different location. And then finally, to sum this up, to finish this up, we have the bursas of the knee, which help to decrease friction. You have 4. Prepatella, which sits on top of the patella, superficial infrapatella, which sits in front of the patella tendon, deep infrapatella bursa, which sits behind the patella tendon, and then the pes anserine bursa, which is where the adductor muscle and the hamstring muscle insert. This page looks really marked up, but you will see a blank page in Canvas where you can look at and study the parts to the knee. Everything that is highlighted is something that will be assessed on the bone anatomy quiz. If you have any questions, let me know. Thanks.